Hello, I am Dr. Ross Jenkins. I am here from Caldwell Foot and Ankle, here to talk to you about a common problem that we see in the practice, and it's plantar fasciitis. So with plantar fasciitis, what happens is lots of people, it's a very common problem that we see. People develop pain right in the bottom of their heel. It hurts really bad when you first get out of bed in the morning. You can, after about 10 or 15 steps, it starts to feel a little bit better. You sit down again for about 30, 45 minutes, it starts to hurt again. Then at nighttime, it kind of throbs or aches. And typically the problem that we see with it most commonly is the fact of a tight calf muscle. People invariably, in the back of their leg, there are really three tendons that form the Achilles tendon. The tendon on the very back of the leg, it starts above the knee, and it's called the gastroc muscle. And so what happens is the more we sit, because the human body in general is lazy, and so we try to sit and not do things as much as we can, and the more we sit with our knees bent, the tighter the muscle becomes. And then when we start to get out and start to exercise, we typically will look at our watch and go, oh, I got 30 minutes. And so we don't do anything before we exercise, and we just go walking, and then that muscle will pull, because God has made this machine that it's a compensating machine for our indifferences where we don't stretch. And so what happens is the primary muscle supports the arch of your leg is called the posterior tibial tendon, and it starts right on the inside of the foot in what's called the navicular bone here, and it comes up the leg. And so as you stand down, if we can see here, as we stand down, if the calf muscle does not bend and it stops, we will rotate our foot when we walk, and the foot begins to collapse. And what that does, it stretches its primary arch supporter. Because when that foot goes down and that muscle fires, it springs the foot back up, and that's kind of your spring mechanism, or what compensates for the ability to walk. And so now, the next major structure that supports the arch of your foot is something called the plantar fascia. And the plantar fascia starts on the bottom of the heel, and it goes out to all the toes. It is like a piece of leather. It does not stretch. Muscles, tendons, and ligaments stretch. The fascia does not. So as that foot rolls out and it starts to collapse, it puts pressure on the band. So always people get pain right in the bottom inside of that heel, and that's because this is the area that's under maximal tension. So what we recommend primarily for it is people start stretching on a regular basis. And what you're going to do is you're going to make sure the knee's extended. And if with the knee extended, because the calf muscle starts above the knee, is then we just want to pull the foot backwards. And the easiest way to do it, if you're lazy like I am, is to put a towel or a belt around your foot and just pull the towel or the belt backwards. You can also stand on some steps and just hang your foot off the back of the steps, but make sure that knee's extended. We start to look at shoes and insoles, and here at the community pharmacy at the hospital, we have some insoles that we recommend from the practice to come in and try. And it will kind of let your foot roll, but it also gives you the arch feel. Shoe gear is also very important when it comes to plantar fasciitis, and it varies on the type of foot that you have. If you walk around a swimming pool and all you see is the toes and the heel and like a little strip on the side like a Carolina Tar Heel foot, typically you have a higher arch foot. And so you're going to look for a shoe that's got a bend to the foot, or the bend to the shoe on the bottom. It's called a curved last. If you look like a bear print, you're typically flat-footed, and you'll probably typically need something like a New Balance or a Brooks tennis shoe or something of that nature, and that will give you a little bit more motion control. And then those of us that have the true Carolina Tar Heel foot, that's called our normal foot. But essentially, anybody can get heel pain, and it doesn't matter if your foot's normal, flat-footed, or high arch, you can end up with the heel pain. So stretching is the primary treatment that we'll see for heel pain. Other things to do for it is rolling your foot on a frozen water bottle. You can ice, at night and so forth, to kind of help decrease the inflammation. Anti-inflammatories are typically utilized to also help with the inflammation. And then don't go barefooted at home, and that's kind of a biggie. But the one thing that I'm just going to encourage today, as far as foot ailments is concerned, is the stretching is what we need to do. There are multiple other treatments available that we can utilize to help get rid of your pain, and the ultimate goal of everything that we do is not to do surgery. So today the topic was plantar fasciitis. I'm Dr. Jenkins with Caldwell Foot and Ankle.